Howdy everyone, Matt and Mateo here, coming at you with another orthopedic special test, and this one is for the thoracic spine. It is Adams forward bend test. This test came from way back in the 1800s by Dr. William Adams, and he described it through his lectures, which was later published in a book called Lectures on the Pathology and Treatment of Lateral and Other Forms of Curvature of the Spine. Whew, interesting test. And through his studies and looking at the deformities and things in cadavers, he developed this test to look for scoliosis. And it is a test that we have probably all done at one point or another in our lives, especially around middle school. It's a pretty simple test to do. So I'm going to have Mateo is going to be the examiner. I'm going to be the person that is going to be have the test done to them. But you have the person remove their shirt or pull their shirt up so you can see the whole spine. I'm just not going to do that here. Have them stand, feet together. You can have them put their hands together like this, and then they're going to bend at the waist. Do not bend the knees, but just to go down as far as they can go. And at least you want to get the spine to a horizontal there. And Mateo, as the observer, what he is looking for is any deviation. Do I see any asymmetries? Do I see one side of the spine coming up? Do I see curves or anything like that? Because if somebody has that scoliotic curve, as you see here, and they bend forward, they're going to get a hump on one side. And that is considered a positive. I will say there is some discussion about things like sensitivity, specificity, the reliability of this test, because it has been found that this test is more sensitive and more specific with a larger curve, so like over a 40% curve. But with smaller curves, it's not as good at detecting, and it has been said that it could lead to a lot of false positives with smaller curves and things like that. And it's even been called into question about even being utilized as an early detection method as well, just because of all these false positives. Additionally, there is another study out there that does describe this test as being a way to say, like, this doesn't predict future spinal pain. Like, yes, you may have a positive now, but it doesn't predict that you're going to have pain in the future, which was pretty interesting to read that. But with all that being said, it does sound like this test is something that could possibly, and I would say, could possibly be used along with other things in the diagnosis of scoliosis. So there you go. That is Adams forward bend test. Let me know about it. Do you ever use it? Have you ever done it? Have you ever found anything with that test? Let us know down in the comments. Be interesting. Do you think we need to, likewise, throw this test out, do something else to detect scoliosis? So there you go. Let us know. And of course, if you like the video, hit the like button. And as Mateo likes to tell everyone, take care of yourself. Take care of your patients. We'll see you next time.